Medical Student Dynamic Documentation. Log into PowerChart and from the Message Center, open a patient's chart. Within the menu, there are two tabs. Workflow Review allows you to begin creating your documentation while reviewing various components of the patient's chart. Provider Documentation allows you to directly create notes. Workflow Review tab is divided into 3 sections to match common workflows. The Admit tab is designed for H&P or consult notes and contains all the components to view when admitting a patient or doing a consult. The Manage tab is designed for progress notes and contains all the components for daily patient care rounds and documentations. The Discharge tab is designed for discharge notes and contains all the components necessary to discharge a patient. The 3 different tabs contain components which are typical for the workflow at different stages of the patient's visit. You can add information to your note while you are reviewing information in these components. Please note that the order of these components is customizable by each clinician to fit individual workflows based on specialty. Select Create Note at the bottom of the components list to start your note. After selecting Create Note, a new tab will open. The Note Type filter is defaulted to your Med Student position. To ensure that your notes are filed to the appropriate folder in the Documents Clinical Notes folder, only use this list of note types when creating your notes. The second selection on this tab is the Note Template, which determines your layout and the automated content of the note. Always select a note template that begins with Med Student. However, any specialty template can be selected as long as the note type has Med Student in the name. To improve efficiency with creating notes, click on the star in front of those Med Student note templates that you use frequently to save as your favorites. It is important that your note type and note template match to ensure proper placement of the document in the Documents Clinical Notes folder. Review the content of the note and add additional information where appropriate, and click Sign Submit to complete your note. Please note the medical student disclaimer that will appear at the top of all med student notes. After selecting Sign Submit, a second window to confirm the note type and note template will appear. Click Sign to finalize the note to the medical chart. Remember to always select a med student note type. Once signed, the note will be added to the Provider Documentation tab. The note will be clearly identified as a Med Student note in the subject column. All notes created will display in the Clinical Documents section of the patient's chart under the Medical Student Documents folder. Depending on the note type selected, the notes will file in the respective Med Student subfolders. Notes are to be reviewed in person with an attending or resident, as med students do not have the ability to forward their notes electronically. If directed to modify your note, select the note from the list, right-click, and click Modify, or select the Modify icon from the toolbar. Add the content that is required and sign the note. After a modification is made to the existing note, a header appears in red font. Document contains addenda. If directed to delete your note, use the right-click option and click In Error or select the In Error icon in the toolbar. There will be a window requiring you to document the reason the note is being marked in error. Your note will display the In Error Report header. As a reminder, you can add note templates to your favorites by clicking on the star in front of the note template name. Once selected, the star will display in yellow and will automatically be added to your favorites. If you add note templates to your favorites, the system will default to your Favorites tab each time a chart is open. To remove a favorite, click on the yellow star to turn the star gray, and it will automatically be removed from your favorites. Thank you for watching the Medical Student Dynamic Documentation video.